Welcome back, guys. Now let's continue with the respiratory physiology. In respiratory physiology, first let's see Weibel's airway generations. Guys, the entire respiratory tract is divided into two parts. Guys, let's look at here. In this diagram, you can see the entire respiratory tract is divided into two regions, that is conducting zone and acinar airways. See, these acinar airways, they are also called as the respiratory zone. Now you might be thinking, see, why this classification happened? Why we have divided the entire respiratory tract into two parts? It is because, see, the first 16 generations, let's say, okay, the first 16 generations. So in these areas, air is there, air is going. When you breathe, the air is going like this. Okay, the air is going, but it is not getting exchanged. So in these areas, air is there, but the perfusion is not there, the blood flow is not there to this region. There is no blood flow. So that's why the air is not getting exchanged. The first 16 generations, they are just helping in the conduction of the air. They are not involved in any respiration. So that's why they are called as a conducting zone, also called as a dead space, because there is no exchange. But here, from the generation number 17 to 23, in this area, alveoli are present. Okay, alveoli are present and blood supply is also there. So there is exchange of gases. So from the generation number 17 to 23, which includes respiratory bronchioles, alveolar ducts and alveolar sacs, in these regions there is exchange of gases, right? So let's look at here. According to this Weibel's airway generations, the entire respiratory tract is divided into 23 generations. There are 23 generations, let's say 23 generations. Starting from 0, 23 generations are there. Trachea is coming under generation number 0. You can see trachea, it is coming under which generation? Generation number 0. And alveoli is coming under generation number 23. Okay, in the 23, there are alveoli present. Now, look, the first 16 generations are called as, see, conducting zone. The first 16 generations, okay, there is no exchange of gases. Just now I have taught you, there is no exchange. And this area is also called as a dead space because there is no exchange. How much is the dead space volume? They will ask you. How much air is there? 150 ml. So the dead space volume is 150 ml. This dead space is also called as the anatomical dead space because anatomically in that area there is no exchange of gases. Next, ends with, the conducting zone ends with which bronchioles? Terminal bronchioles. You can see here the conducting zone, generation number 16, it is ending with the terminal bronchiole. Any important point about the terminal bronchiole? Yes, there is an important point around the, about the terminal bronchiole. That is, terminal bronchiole contains maximum smooth muscles. Okay, they contains maximum smooth muscles. Next step, let's see about the respiratory zone. That is from the generation number 17 to 23, respiratory zone. There is exchange of gases, you already know it, guys. Respiratory zone includes which structures? Three important structures are there. I have already taught you, that is respiratory bronchiole, alveolar duct and alveolar sac. These three things are there. Together, all these things, three things called as the acinus. Okay, one respiratory bronchiole along with its alveolar duct and its alveolar sac together called as acinus. So that's why these airways are also called as, the respiratory zone is also called as the acinar airways. Acinar airways. So you should know what are the structures included in the acinus: alveolar duct, alveolar sac and respiratory bronchiole. These three things are there. Why? Because in your second year you will study something about pan-acinar emphysema, centri-acinar emphysema. Okay, so you should know what exactly is an acinus made up of. Okay, next step. Let's begin our topic with the conducting zone. Okay, conducting zone. First, let's see what are the important points that you should know regarding the conducting zone. See, in the conducting zone, what is the lining epithelium present? Which type of epithelium is present? In the conducting zone, there is pseudo-stratified, ciliated columnar epithelium. Pseudo-stratified ciliated columnar epithelium. Now, what is the importance of the cilia? Okay, what is the importance of the cilia in our respiratory tract? Just for decoration purpose? No. The cilia is helping in the clearing the sputum. Whatever the sputum that is getting produced, whatever the mucus is present in our respiratory tract, which is trapping all the dust and germs. So we have to clear it. Otherwise, the mucus will block our respiratory tract. That can lead to infections, bronchiectasis. So we have to clear the sputum always. So who will clear the sputum? The cilia. Cilia, it helps in the clearing the sputum. So right, What is the importance of cilia? Cilia helps in clearing sputum. Okay, helps in the clearance of the sputum. Not only that, any other important point about cilia? Any other important things? See, cilia not only helping clear the sputum, but during the embryogenesis, during the developmental time, I am talking about. Cilia helps in the movement of the organs. Cilia helps in movement of our organs. So, why I am talking about this right now, I will explain you. Cilia helps in the movement of our organs. Next, stem cells. What are the stem cells which are present in our respiratory tract? That's especially in the conducting zone. See, because of smoke, cigarette smoke, dust, see, usually the lining epithelium will undergo damage. So, whenever the lining epithelium is undergoing damage, there should be certain cells which is kept on constantly replacing the damaged cells. Which cells replaces the damaged cells? Stem cells, we all know. So, what are the examples of stem cells in the conducting zone? The stem cells are basal cell and Clara cell. So, basal cell and Clara cell, these cells, okay, basal cell and Clara cell, where they are present in the conducting zone, guys. Okay, they helps in the replacement of the damaged cells. Now, what are the ciliary disorders? If the cilia is not beating, like if they are not moving, definitely it will lead to the mucus accumulation in the respiratory tract, that can lead to the infections. So, what are the ciliary disorders? Two important ciliary disorders you should know, you must know for your exam. One is Kartagener syndrome. Kartagener syndrome and cystic fibrosis. Okay, Kartagener syndrome and cystic fibrosis. So, in these two disorders, there will be no beating of cilia. Cilia is not beating. First, let's start our topic with the Kartagener syndrome, which is the autosomal recessive disorder. Okay, both are autosomal recessive. Cystic fibrosis was recently tested. Okay, cystic fibrosis repeatedly tested in the exam. Okay, autosomal recessive disorder. First, let's begin our topic with the Kartagener syndrome. What exactly it is? Kartagener syndrome, it's an example of, okay, primary ciliary dyskinesia. Okay, primary ciliary dyskinesia. In the name itself, it's that primary meaning what? Primary means some problem within the cilia. Some problem happened within the cilia. So, primary ciliary dyskinesia means cilia not beating properly, cilia not moving. Why? Let me tell you, there is a protein called as a dynin. Okay, dynin. Where is it present? The dynin, it is present in cilia and as well as flagella. Okay, it's a dynin protein. It is present both in cilia as well as flagella. It helps in movement of cilia. Helps in movement. Okay, helps in the movement of cilia as well as flagella. The bending of the cilia and flagella is because of this a dynin protein called as a dynin arms. There are dynin arms in the cilia and flagella. So, this dynin arms are made up of a protein called as a dynin. So, at the end of the day, dynin, it helps in the movement of cilia and flagella. But what happens in the Kartagener syndrome? There is a defect. Okay, there is a defect in dynin. Okay, now dynin gone. Now, whenever there is defect in dynin, do you think cilia will move? No. Flagella, do you think will move? No. So, there is immotile cilia and flagella, you can say. So, there is going to be immotile cilia and flagella. Okay, immotile cilia and flagella. Cilia is not beating as well as flagella is not beating. Now, you tell me, when the cilia is not beating, okay, when it is not moving, do you think mucus will be cleared out of our body? No, the mucus is not going to be cleared from the paranasal sinuses. Mucus will be not cleared from the respiratory tract. So, mucus is going to accumulate, leading to infections in the sinuses. Okay, so sinusitis, infection followed by inflammation. So, the cilia which is the present in your paranasal sinuses, do you think it will move now? No, the cilia is not beating. So, the mucus whatever is produced in your paranasal sinuses, it's not going to be cleared. Now, whenever there is no clearing of the sputum, that sputum will block the paranasal sinuses, leading to the infection followed by inflammation. So, these patients will have certain clinical features, like these patients will have chronic sinusitis. Okay, they will suffer with the sinusitis. Because of the infection of the respiratory tract, the mucus will also accumulate in the respiratory tract, leading to infection followed by inflammation, leading to the destruction of the bronchi. So, that is bronchiectasis. Okay, so there is going to be severe massive bronchiectasis is going to be seen. Next, as the cilia is not beating from the childhood onwards, from the birth itself, this problem is going to be there from the birth itself, from the developmental time itself. As the cilia is not beating, do you think the organs will move? Previously I have told you the cilia will help in the movement of the organs. Okay, cilia helps in what? Movement of the organs. Cilia helps in movement of the organs. But in this condition, do you think the organs will move? No. The heart, which was supposed to be on the left side now, it will be on right side. Actually, during embryogenesis, the heart is actually more towards the right side. Because of the ciliary beating, the heart will move to the left side. The apex of the heart will be moving towards the left side. But in this condition, Kartagener syndrome, as the cilia is not beating, the heart now, which was supposed to be on the left side, now it will be on the right side. These people will have situs inversus. Okay, situs inversus means opposite side placement of the organs. Situs inversus means, site means the site is going to be opposite. The organ site is going to be opposite. Now, what is the example of this situs inversus? The classical example of the situs inversus is dextrocardia. Okay, dextrocardia means right-sided heart. So, with this, what we have completed? We have completed the Kartagener syndrome. And what are the triad of symptoms? This is very, very important, guys. What are the triad of symptoms that are going to be seen? The triad of symptoms that are going to be seen with the Kartagener syndrome, that is chronic sinusitis, bronchiectasis and situs inversus. Apart from this triad, any other involvement will be there, any other clinical features will be there. See, in this fellow with the Kartagener syndrome, flagella is also not beating, right? Flagella is also not moving. When flagella is not moving, do you think sperm can move? No, sperms cannot move. They cannot go and fertilize the womb. That can lead to infertility. So, because of the immotile flagella, okay, immotile sperms, the person can suffer with infertility. Okay, these people can suffer with infertility also. So, that's not included in the triad, but you have to know it. Infertility will be there. These people can be infertile. So, with this Kartagener syndrome completed, which is an example of primary ciliary dyskinesia, that there is some problem within the cilia itself. Next, let's discuss about the cystic fibrosis. Okay, cystic fibrosis also autosomal recessive disorder, but it is not a primary ciliary dyskinesia. There is no problem with the cilia. The problem here is with the mucus. What is the problem? Let me tell you. In cystic fibrosis, there is a gene mutation. There is a gene mutation. Which gene mutation? CFTR, cystic fibrosis transmembrane regulator gene. CFTR gene mutated, gone. CFTR gene gone. Because of the CFTR gene mutation, there is going to be defective chloride channel. Okay, there is going to be defective chloride channel. So, what will happen, sir? Let me tell you. See, here, this is the healthy respiratory tract, let's say. In the first diagram, I am showing you the healthy respiratory tract, where in these epithelial cells, these are the epithelial cells which are lying, in the conducting zone. Okay, let's say in the respiratory tract. Now, look, in these cells, the CFTR gene is functioning. Okay, the CFTR gene is functioning. Now, when the CFTR gene is functioning, what this CFTR gene will do? The CFTR gene codes for a channel called as the chloride channel. Okay, whenever the CFTR gene is functioning, the CFTR gene codes for this chloride channel. Now, what this chloride channel is always doing? Chloride channel, it is always kicking the chloride. See, it is kicking the chloride into the mucus. This green color region which I am highlighting, that's the mucus, that's your mucus, and these are your cilia. Okay, these are your cilia. Fine. So, finally, this healthy respiratory epithelium contains this CFTR genes. These CFTR genes are active. The CFTR genes code for a channel called as a chloride channel. So, chloride channel is always sending the chloride. So, always sending the chloride into the mucus. Okay. But what happens in cystic fibrosis? Okay, what happens in the cystic fibrosis? Look, in cystic fibrosis, the CFTR gene is mutated. Okay, CFTR gene is mutated. Now, because of which, do you think chloride channels are there? No. Now, there are no chloride channels. So, chloride, do you think is it going out? No, the chloride is not going out. But which channels are functioning? Only the sodium channels are functioning. Previously also, the sodium channels are functioning. Chloride channels is sending the chloride out and the sodium channels are bringing the sodium in. So, there is exchange of this ion, sodium in, chloride out, sodium in, chloride out. So, water is also coming into the cell, going out of the cell. Water is also coming in, going out of the cell. There is a balance. But right now, what happened? In cystic fibrosis, the chloride channels are not there. They are not functioning. Only the sodium channels are functioning. So, sodium is going to come into the cell. Whenever sodium comes into the cell, what happens? Now, there is more sodium inside the cell. Now, there is more chloride into the cell. Now, inside the cell, there are more ions. Now, this ions, okay, this more ions, sodium chloride, what they will do? They will try to attract the water. Now, from the mucus, now the water will go into the cell. Okay, now what is happening? The water is coming into the cell. So tell me, what do you think will happen to this? What will happen to this mucus? Now the mucus is going to become thick. Now there is a thick mucus. Thick mucus. Okay, now there is going to be thick mucus. Now do you think whenever the mucus is so thick, it is very thick, super saturated, do you think that the cilia can move this thick mucus? There is no problem with the cilia, but the mucus is very sticky, very thick. Do you think the normal cilia can clear this thick, sticky mucus? No, not possible. So that's why the problem here is not with the cilia, but with the mucus. Okay, right? What happened? In cystic fibrosis, CFTR gene gone, chloride channel gone. So there is going to be thick secretions. Okay, thick secretions. Now these thick secretions makes cilia immotile. Okay, so again cilia is not going to beat. Now these thick secretions, do you know what they will do? They will block the respiratory tract, leading to the infections, bronchiectasis. Okay, the cystic fibrosis patients, okay, there is this thick secretions block respiratory tract, leading to bronchiectasis. Okay, these thick secretions can block your pancreatic duct. Okay, so the thick secretions are not only going to be there in the respiratory tract, these thick secretions everywhere in the body, the gastrointestinal secretions, the respiratory secretions, the urogenital secretions, every secretion is going to be thick. This cystic fibrosis is not just a lung problem, it's a systemic problem. Everywhere in the body, the secretions are going to be thick. Now, when the pancreatic ducts are blocked, what will happen? That can lead to pancreatitis. Okay, pancreatitis. So, pancreatitis is considered to be the most common extra pulmonary manifestation. Apart from the lungs, what else can be most commonly affected? It's the pancreas. Pancreatic ducts are blocked. So, pancreatic enzymes is going to cause the autodigestion of the pancreas, leading to the acute pancreatitis. Okay. So, yes, cystic fibrosis patients will have pancreatitis. Actually, it's a chronic pancreatitis, guys. Okay, long term, right? It's a systemic disease, long term, right? So, the patients can have chronic pancreatitis. Chalo, next step. So, what is the treatment that you have to do in this condition? Treatment. You have to make the chloride channels functional again. You have to use certain drugs which makes the chloride channel functional again. So, what is the drug? The drug called as ivacaftor. Ivacaftor. Okay, and lumacaftor. So, ivacaftor, lumacaftor, these are the drugs. Okay, ivacaftor, lumacaftor, these are the drugs which will help in the clearing the sputum again. Okay, they will make the chloride channel functional again, will make the mucus again diluted. Okay, but the one important MCQ which I want you to know is, see, the cystic fibrosis babies. Okay, cystic fibrosis is going to be there from the childhood onwards. The cystic fibrosis babies, okay, do you think they can pass the feces easily? Imagine there is a baby just delivered and this baby is suffering with the cystic fibrosis. Usually babies, once they are delivered, they are going to pass the meconium, first feces, right? But in this baby, do you think the baby can pass the feces easily? No, not. Because the mucus, whatever is getting produced in the baby's intestine for the 9 months, the mucus is also going to be very sticky, right? Very sticky, very thick. So, do you think the baby can pass the meconium? No. So, cystic fibrosis babies, there will be failure to pass the meconium. So, in this child, there is failure to pass meconium. So, whenever in your exam, if you see a case where they are talking about failure to pass the meconium, you have to think about the cystic fibrosis. Okay. Yeah, failure to pass the meconium is also seen in other conditions like Hirschsprung disease and atresia in these diseases also. But you have to know, okay, cystic fibrosis babies, thick mucus, so there is failure to pass the meconium. And one more thing, do you know what the cystic fibrosis baby is called as? The babies with the cystic fibrosis, they are called as salty babies. Salty babies. Why? Because there is more chloride secretion. All this excessive chloride is there. No, all this excessive chloride, see, the chloride is not going to the mucus, but the chloride will start to come up in the sweat. Okay, the chloride is coming out in the sweat. Now tell me, whenever there is more chloride in the sweat, what will happen? If you kiss the baby, when the mother kisses the baby, when the mom kisses the baby is going to taste salty because of this excessive salt, chloride. So, these babies with the cystic fibrosis, they are also called as salty babies. So, with this, successfully what we have completed, guys, we have completed the Weibel's airway generations. Also, we have completed the topic of a conducting zone, the normal conducting zone, and what happens if the cilia is not beating, the two ciliary disorders. One is a primary ciliary problem, that is Kartagener syndrome, Other is a secondary ciliary problem, where the problem is not with the cilia but outside the cilia, that is thick mucus. Okay. I hope the video is helpful. In the next video, we will be discussing about the respiratory zone. Thank you.